Okay, so to make our temporary crown, which our patient needs to go home with, it protects the margins of the tooth. It protects the sensitive parts that have been exposed, the dentin and everything when the tooth is prepped, and it also protects the function of the tooth so they can chew. Sometimes the aesthetics too, so they can smile and it'll look pretty. We need to send them home with a temporary crown, and as a dental assistant, it's our responsibility to make that temporary crown. So we take our preliminary impression, okay, and we do ours on typodonts. It's kind of different than it is with a patient because a patient has cheeks and saliva and they can feel, and so we also have a different type of impression than we would usually use on a patient. This is a putty impression. So what we do with ours is that we choose the tooth that we want to do, the prep tooth. Each of these will have a prep tooth on each side, and then we choose the matching impression. This has a J on the back and then it says 5. That's for tooth number 5, okay? So it should fit on there. It should fit very easily. If you have to force it at all, it either is the wrong impression or you have it on there wrong. You shouldn't have to force it. If you force it, you will break these every single time. So I really don't want you guys forcing them on. It should come on and off very easily. All right, just like that. So you want to locate the tooth inside of the impression that matches the prepped tooth. So we want to make sure that we locate number 5 inside of this impression. And then what you want to do is you want to just practice putting this on, looking, figuring out where you're going to extrude the material onto. Okay, because once we get the material in here, there's a limited amount of time that we have to actually get this impression on the tooth. We also have to get it on the tooth in a fluid motion, because if we do go up and down with the material on it like this, it's going to create bubbles and voids and it's going to make a bad temporary. So it's important that with the model that we try it, but also with your patient. When you have your preliminary impression with your patient, before you go to start making the temporary, make sure that you just try that preliminary back in their mouth again. Sometimes it can fit in an unexpected way and it takes a little bit of practice. So I've got my tooth number 5, I've got my tooth number 5 here. Okay, the next thing that we need to do is we need to create saliva on our typodont. Our typodonts don't have saliva without it. Our temporary impression material, our temporary crown material will stick really, really bad to this typodont, and then you'll spend about 10 minutes cleaning it all off. It's not very fun, so please always remember to use our canola spray. If you do too much and you do it really close like this, it's going to mess with the setting time of our material, so you want to do it from a distance. This is to not get it built up, but this is also because this material is going to flow onto the adjacent teeth, and we want to make sure that the adjacent teeth are also covered. So you go back here, okay? You don't have to do a ton. And then I like to take my finger and kind of rub it all in. All right, so next what we'll do is we'll use our temporary material gun and we'll use our impression. There's a special technique to this. Now these auto mix tips are one-time use only. They are expensive. So I want to make sure that you're never only doing this by yourself, that when you do this process in school, that you have one, preferably 2 other people who are ready to go with you. All right, they're ready, they're set up, they're sprayed, they've got everything. Everybody's agreed that they're ready to go. So you're going to slowly extrude the material into, can you see right there? Mm-hmm. Into the tooth. What we want to do is we want to backfill. So we don't want to leave the tip really far down into here while we fill it up, because when we go to pull out, it will create a bubble. The other major mistake that people make is they think, oh, I want to fill up all the parts of the tooth. So they go, oh, I want to fill up here, and I want to fill up there, and I want to put it there and there. That's also going to create bubbles. It's kind of counterintuitive, but the best thing you can do is keep this tip as still as you possibly can inside of this. So I put the gun up against my chest. I also, you can see I'm using my fulcrum here. I'm touching the gun, right? That way I'm not going like this, because it can be very difficult with that little bitty tip to keep it still. So make sure you're touching it somewhere. So you're going to see what I mean by backfilling. It means that I'm keeping the tip just barely in the material. Okay, you see how I'm not letting the tip get buried by the material? And I'm not moving the tip. I'm not putting it in separate cusps. I'm just letting it fill up. Okay? You want it to bubble just over the margins. And then you gently and carefully, like we practice, put it onto the typodont. Okay, then what you do is you extrude a small amount onto your glove or onto the table. This is so we know how quickly it's setting up, and then you pass it on to the next person. Now, as we're waiting for this to set up, you can tell when it's set up, because if you touch it and it sticks to your glove, it's still gooey like that, it's not ready. We don't want to let it set up all the way and completely harden. It can become locked onto the tooth, especially on these typodonts. It can be locked onto the tooth, and then you have to break it off. It's not the end of the world, but it means you have to break it off the patient's tooth and then start over and make a new one. So we just want to keep checking. Still not quite ready, but we're getting close. Okay, when it starts to act like one solid piece, okay. So once it's one solid piece, I like to wait about 10-15 seconds, and then I like to take it off of the patient's mouth, because that's when it's going to come out with our impression. We really want our temporary to come out with our impression. With the typodonts, it tends to rip when you do that because of the way that it is. So I like to wait about 20 to 30 seconds after my piece becomes solid. So I think that it's been about that long. So if we're lucky, this will come out with our impression and won't stick to our typodont. It's stuck to the typodont, but that's okay. There's a bunch of extra here. I guess I put a little bit too much material in there. So if it stays on the typodont, no big deal. Just don't take it off too quickly, because you're going to risk ripping it. It's still kind of jelly-like right now, and so we just want to leave it for about 10-15 more seconds. Then I like to take the curved hemostats and very, very gently grab. You want to be very ginger with this. Okay, got a temporary crown here. All right, at this point is when we would want to trim it. You want to wait it for it to harden completely, okay? So put it aside, put it in your pocket, whatever you need to do. While you're waiting for that to harden, what I want you to do is I want you to take an instrument and I want you to just go over this and make sure that there's no material left over. Once that material hardens on here, it's difficult to get off, okay? Once we're ready to trim, we won't actually trim this one, but I just want to show you that when you trim, you always need to be using your fulcrum. So this is a high-speed handpiece and a high-speed burr. If you're not careful with it, it can hurt you, so you need to respect the fact that it is dangerous. That being said, it's easy to use. Just make sure that you're touching your hands together. Always use your fulcrum. And then when you're trimming, I want you to be trimming against the wall like this. I never want to see you trimming like this. What happens when we trim like this is all we do is we reduce the margins of the crown and we ruin it. It may seem like you're getting off material, but you're getting it off in the wrong manner. We're really looking for it to be smooth, kind of like this, so we want to trim always like this, never like this. Okay, you can also do it like this. Sometimes this is easier to keep from doing that like this, never like this. Okay, once we have trimmed our temporary crown, we need thin margins that meet the tooth but that don't impinge on the gingiva, but we don't want thick margins. It's important though that we don't compromise the contacts by making the margins thin. So it takes a little bit of technique to make sure that while you're thinning the margins, you're not opening up the contacts. We need to make sure that the contacts stay nice and tight, so that way the teeth adjacent to the prep tooth stay in their place and the permanent crown will fit. So when we've trimmed it, and then we've checked the occlusion with articulating paper and make sure that they're not biting high, okay? Then we're ready to temporarily cement it in. This is Temp Bond. Comes in a little syringe that says Temp Bond. This should have a plunger in the end, and you just take off the end. You push the plunger and it puts equal amounts onto a paper mixing pad. Okay, so make sure that you dry the patient's tooth, wipe it off, make sure that there's no bleeding or saliva or anything present. You can use this. You got to be very aware. Now, a patient is numb when we're drying their tooth in this procedure, but during a crown seat, they are not numb, so do not blow air on their tooth during a crown seat. All right, once everything's dry, we are sure that everything fits correctly. Let me just double check how this fits on again. There we go. Okay. So you might want to try it in to make sure that you know that you're putting it in on the correct manner in the correct orientation. So once you're ready, you're going to mix up the temp bond. Mixing with a spatula and a paper mixing pad is very easy. All you do is you just scrape it. Spit it out. This stuff is kind of old, so it doesn't look great. Okay, see, it's all mixed up. It only takes a few seconds. This temp bond won't last forever, so you need to make sure that you're ready to put it in the tooth and cement it when you mix it up, because if you leave it for too long, it will set up. Okay, so we put some in there, just like that. And I make sure that I'm seating it correctly. Okay, you're gonna put it up in there. Then what I like to do is I like to put a cotton roll or a piece of gauze, and I ask the patient to please bite down firmly. That seats it the rest of the way. Okay, we need to make sure though that we clean off all of this extra temp bond, so I forgot to get floss. So we wipe off as much as possible. We need to make sure that, all right, so we need to make sure that we wipe this as good as we can. We want to get all of the temp bond off the patient's gingiva. This also all needs to happen before it sets up completely. So just keep wiping away, all right? Make sure that you always wipe off your spatula. You don't want the cement to actually set up on your spatula. I like to take a micro brush personally, and I like to use that to clean as well. It scrubs those margins very nicely. Okay. Then when it's close to being set up, not all the way there, but a little bit of the way there, you're going to want to floss. We want to get this material out interproximally. You need to be really careful when you floss though, because if you just pull up and down, you can just pop that temp right back off, and then you have to re-cement it again. So what you want to do is you want to floss down around the side, up and down like this, but you do not want to pull it back out. You want to pull it through. And then wrap gently. And then pull it through, okay? Both sides. Sometimes when I'm doing this, I hold my finger down on that temporary. And then you'll also want to give the patient a good rinse afterwards, because this does not taste good. All right, basically this temp cement will finish setting up, and we'll get it all completely cleaned off with the patient.